Good morning, everybody. I'll get us started. My name is Tanya Bubler, and I'm the Dean of the Faculty of Health Sciences at Simon Fraser University. I'm just watching all of the signs coming in, the messages, and we already have people from all over the province. So a very big welcome to you all. We have an action-packed couple of days coming up, and I'm going to start by inviting Elder Margaret George from the Squahaluk First Nation to give us a territorial welcome. Elder Margaret?
Good morning.
Good morning, Elder Margaret.
How are you?
I'm very good.
So welcome to everybody who is attending this very special meeting. Seems so weird just looking at this little toy here, not seeing everybody. But welcome to the territory of the First Nations in the Vancouver area, Coquitlam, Musqueam, Squamish, and Tsleil-Waututh. And just a quick prayer to get your meeting going. Great Spirit, guide each and every one of us on the path that we're in, clearing each one's mind of all the fears and of what is happening within our communities. I ask Great Spirit to give each and every one strength for the work that they're doing, thanking their communities and their families for allowing us to do that work that we do. I ask Great Spirit just a very special blessing on this meeting for each and every one within this meeting, all my relations.
Thank you, Elder Margaret. I hope you'll enjoy the sunshine and in Tsleil-Waututh across the way. I can almost see you.
Not sunny, but we had a visitor last night. The big bear was roaming the neighborhood.
Oh.
Yeah.
Well, hopefully that's a good sign.
Didn't see him, but he left his calling card and got into the garbage next door. And
he comes and visits us as well, just around the corner.
Yes.
Thank you, Elder Margaret. And now I see that we have Dr. Bonnie Henry on the line. And she needs no introduction as our Provincial Health Officer, but she also has a few words of welcome. And I'd like to invite Dr. Henry to kick off our 2-day symposium.
Thank you. Thank you very much. It's wonderful to be here again. And thank you to our elder, Margaret George, for your words of wisdom. We've had a cougar wandering around here, but nothing as exciting as there. And I do want to recognize that I'm the traditional and unceded territories of the Lekwungen speaking peoples today, of the Esquimalt and the Songhees First Nation, and I'm really grateful to be able to talk to you all from this wonderful place. This is another really important meeting, and I can't express enough how proud I am that we have managed in such a coordinated way to have this important research being done here in British Columbia. We really set things up early, and thanks to Michael Smith and to Bev and to David. And I think the coordination and collaboration across universities and across the province is unique in Canada, and it has meant we can have a breadth of research that actually informs our day-to-day decisions. And much of the work that you'll be talking about in the next 2 days is things that are a daily basis coming to our decision-making process at the public health level, at the clinical level, and at the political level in terms of helping drive the work that we're doing and decisions that are being made by government. I do want to say that, it's evidence itself never tells you what to do. It is important and it helps us, but it is this collaboration and talking about it. It's in the context as well of the values and the preferences and the judgments that we all hold and that we all, and that's why collaboration, discussion of the evidence is so, so important. And it is a value judgment in setting things like the thresholds of where benefits outweigh risks. And that is the place that we are in now. And it is so much, so important to us to have the work that you're doing and that we'll be talking about and we'll be talking about. I'm going to try and join as much as I can over the next few days, because we are at the place where we are trying to find that balance of making sure we get our children back to the education they need, we get people back to work, that we get our communities working and back socializing, supporting each other again, getting our medical system up and running again, knowing how to manage this virus and live with it, because we're going to be living with it for some time. And the work that we're seeing, and I was looking through the program and I didn't realize all of the things that were going. I know a lot of them, but some of it has been forming our decisions to this point, and much of it is what we are going to need to keep our communities together and working and learning and growing over the next coming months. So I'm appreciative of all the work that people are doing together, and I'm appreciative of the data and the information that we get from you. And I look forward to this ongoing collaboration over the next few months to years as we weather this storm together.
Thank you, Dr. Henry. I'm now going to turn it over to a formal and official welcome to my co-chair, Dr. Peter Berman, the Director of the School of Population Public Health at UBC.
Thanks very much, Tanya and Elder Margaret. Thank you for those words of wisdom and thoughtfulness to get us started. And Dr. Henry, thank you as well for your words of introduction. It's our privilege to be able to all work together and support the work that you have led us so ably in these past months. Just to get us started, I would like to just comment briefly on what brought us together, go over in the high outline form our agenda and plan, and then share some housekeeping issues that we all should try to adhere to to make this a successful event. I think that what launched our collaboration to organize these next 2 days was the recognition that while there has been a great deal of attention and collaboration around the clinical and biomedical dimensions of response to the COVID-19 crisis, there also are really important public health, population health services, and systems issues and impacts on populations as a whole that are getting a lot of attention in British Columbia. We have an amazing group of colleagues and researchers and collaborators working on these issues. And we wanted to make sure that attention was also focused on these issues, and that this group of colleagues had a chance to learn from each other what they are doing, what kinds of questions they are investigating, and what they do with what they are learning from these investigations, and also perhaps to spark some new opportunities for collaboration from this communication. I would say our focus in these 2 days, just by the number of people who responded to this call, is going to be more on breadth than depth. Those of us who want to get into the details of every particular research design and method will probably feel a little frustrated and have many questions. But our intention is not to try to answer all those questions in this 2-day event, but rather to create the connections that let each of us follow up and be able to answer those questions. I would also add that part of what motivated us to organize these 2 days is the recognition that while this virus causes great human cost in terms of poor health, even death and suffering in many ways, In our province, we've actually been relatively fortunate, and this is not to diminish the burden that it has placed on many people, but we've been relatively fortunate that these direct effects of the disease have been somewhat mitigated by successful public health efforts. What this has resulted in is that we see increasingly the importance of the other factors that matter in terms of being able to address this pandemic, both the other kinds of burdens these impose on people, but also the importance of reaching out to different populations and engaging them and getting their support and participation in the ongoing methods and approaches we need to control the pandemic going forward. And so it's this balance between the clinical and biomedical side and the social, population, health system side that we wanted to assure with this two-day event. Let me turn now to the agenda. We'll have two overview sessions. The first one right after this on strategic priorities and frameworks. And the second one, first thing tomorrow morning, on support platforms and methods. These are sessions 1 and 5. There are 5 thematic sessions, which will be led by keynote speakers. And we've tried to identify those who are already engaged in funded research from CIHR, SSHRC, Michael Smith Foundation, and others to share their work as examples, not as the only word, but as examples of what can be done. And these are sessions 2 on development and implementation of public health measures, session 3 on population impact of public health measures, which will include focus on gender and sex impacts, impact on health service and workforce, other impacts and unintended consequences, and globally focused research. And finally, our session 8 will be a synthesis, and rapporteurs for each of these sessions will have a chance to briefly summarize the discussions. For most of these thematic sessions, there will also be subsequent breakout opportunities where researchers can share work, meet, and exchange questions and ideas. So participants will be able to select the breakouts that they want to join. And we will have a chance to synthesize these ideas, learning back from the rapporteurs. Now, some of the technical aspects of what we're about to undertake. I want to start by thanking very much my colleagues at SFU, especially Dean Bubala and her team, Kat Salvante, the IT team, who've helped us organize this. This is a big event, and it was put together very quickly with minimal resources. Many participated in the organization and planning meetings, and many are participating in the meeting itself and contributing their ideas. So thank you to all of you. I think we should be modest and beg your forgiveness as we endeavor to make this work technologically. There are limits to the technology, and we hope that everything will work well. Please bear with us if it doesn't always work as we would want it to. The themes and the problems we're addressing are very broad, and perhaps not everyone's particular area of emphasis will be ideally represented. We had a very broad and participatory planning process. We included patient and community groups in this process. If you feel your views are not coming through, please do try to contribute and engage in the meeting. All views are welcome, and in an effort of this size, it's inevitable that not everything got equal airtime or representation. So please bear with us on that. The main sessions are being recorded and live streamed on the Faculty of Health Sciences SFU YouTube channel. You can find the links on the agenda that's been circulated. Recordings will be publicly available following the symposium through the BC Academic Health Network's YouTube channel, and those links will be provided to you. It's very important that we stay on time, and I'm watching the clock. I've got a minute or so left. Chairs will do the timekeeping in each session. They will get feedback through Slack, and the Masters of Ceremonies, Dean Bubala and myself, will try to start each new session on time and introduce each chair on time. All participants will be muted through the system, but if you're not muted, please try to remain muted. Hosts and co-hosts will be able to unmute you for questions and comments. Use hand raising and chat as much as possible. The following hashtag when tweeting about the symposium should be used. Hashtag BC COVID research, and this will be shown to you as well, sent around in the chat. All of the main sessions will use this main symposium Zoom meeting link, but the breakout sessions, and this is very important, have their own Zoom meeting links. On the final agenda, you will find the logins for those Zoom meetings for the breakouts. You will need to log out of this main session and log into a new session for the breakout room that you want to select. Then you will need to log out at the end of the breakout discussion and come back to the main meeting. And I know this is a little complicated, but this is the only way we were able to manage this opportunity for breakout sessions, which are opportunities for discussion amongst subsets of individuals interested in specific topics. And we hope that this will serve to develop new energy and synergies and make connections. Breakout sessions will not be recorded. So that's by way of introduction. And now I'm going to turn the floor over to Bev Holmes, who's going to be the chair of the first session, Setting the Scene, Strategic Priorities and Frameworks. Bev, please unmute yourself.